Most women entering and throughout their menopausal years will experience hot flashes. They're not a disease, but they definitely affect your quality of life. Now, some women may not experience them so much. They'll be mild, maybe even very short-lived, maybe only have them for about 6 months. For many others, they can start years before your last menstrual period and go on for years after. And you can experience fierce flushing of the face and your upper body, severe sweating, and that could be followed by chills, a cold, clammy feeling. A hot flash can last typically for 30 seconds to up to 5 minutes, and about 85% of women experience them. Hormone replacement therapy is effective for treating hot flashes. But remember, hot flashes are just a quality of life issue, not a disease. So many women do not want to take these medications. They don't want that increased risk of cancer and developing blood clots that are related to using hormone replacement therapy. Resveratrol and grapeseed extract are two supplements. They may combat the symptoms of menopause, especially hot flashes, almost as effectively as hormone replacement therapy, but without the cancer and blood clot risk. In fact, they're very good for you. They're very good for your heart, and they're very good for your brain. Welcome to our Safe Help for Hot Flashes episode. Hi, my name is Jerry Hickey. I'm a licensed pharmacist who also has studied nutrition. I'm over here at Invite Health. I'm also the scientific director, and I'd like to talk to you today about simple changes you can make to your lifestyle and your diet and several nutritional supplements that safely help you and reduce the burden of hot flashes. Please be sure to subscribe to our Invite Health podcast and please leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. All of today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get going. So what is a hot flash? Well, your estrogens and your other sex hormones are fluctuating rapidly up and down. A part of your brain senses this. It's called your hypothalamus. The hypothalamus is the great regulator. It's in a more primitive part of your brain, in the back of your brain, down right above your neck. And it senses changes in the body and tries to balance things. So the hypothalamus gets confused. It responds thinking your body is overheating because the fluctuations in these hormones affect your blood vessels. The brain thinks you're overheating. So the brain causes your blood vessels near your skin to dilate, which means widen. They widen to let off the excess heat. This occurs mostly in the skin near your head, face, neck, and chest, accounting for the symptoms. When your blood vessels return to normal, you can cool down again. Before we go any further, let's go to a quick break. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. This is our episode, Safe Help for Hot Flashes. My name's Jerry Hickey. I'm a pharmacist nutritionist. The flushes can disrupt your sleep, and this, of course, leads to daytime fatigue, and it's hard to control your... you might not feel so happy about things. It can lead to depression and anxiety. It can also make your blood pressure rise when you're having a hot flush, and your heart can actually race. So lifestyle changes can help. For instance, stay away from caffeine if you can. Caffeine increases the effect of the hot flushing. Smoking affects your blood vessels It's going to affect your number of hot flushes and how severe they are. Alcohol always raises your temperature a bit initially, and then it makes you cool down. It'll complicate the hot flushes. Being obese, it's time to exercise. Get rid of some of that fat. Fat is metabolically active. Fat is not just storing calories for later use. Fat is leaving off chemicals that make you inflamed, and they do complicate your hot flushing. Wear loose clothing. And cotton, by the way, if you use cotton, it can absorb some of that extra perspiration that you release during a hot flush. Use lightweight blankets at night so you don't overheat. You might even want to leave a window open. I would certainly lower the thermostat in your bedroom. They say that a glass of cold water can help offset a hot flush. Worth trying, very safe. Now, let's talk about supplements. Resveratrol can help, and so can grapeseed extract. Now, resveratrol is found typically in the skin of a red grape, but that's only tiny amounts. So in the studies, they use Polygonum cuspidatum. That's also called Japanese knotweed. It's a type of grass. As far as grapeseed extract, the best grapeseed extract comes from the pip of white grapes. Both the grapeseed and the resveratrol are extremely safe for you. They're very good for your brain, your circulation, your heart. They can help reduce the number of hot flashes, the duration of hot flashes, how long they last, and the intensity of the hot flash. They really help. They can really restore your quality of life, which is not something simple to do. Restoring how much you enjoy your life. Now, let's talk about some of the studies. This is grapeseed. And I'm just going to pick out several studies on both the grapeseed and the resveratrol. In a study by the Mayo Clinic looking at the safety of grapeseed extract, did it affect hormones? It was a 3-month-long study in older women. It had no effect on their hormone levels. It worked by improving blood vessel health. So the Department of Women's Health, Tokyo Medical and Dental University, gave grapeseed extract, 2 different doses, 100 milligrams or 200 milligrams, to women who had hot flashes. They gave them the grapeseed extract every day for 60 days. Some of the women also received placebo. Grapeseed extract very successfully reduced the number of hot flashes. It significantly reduced insomnia. It reduced anxiety. It improved depression. It was good for their blood pressure. It really had an impact. It really had a very good impact. It was safe. It also, by the way, improved their muscle health. You know, women tend to lose tone later on in life in their muscles. The conclusion by the researchers: grapeseed extract is effective in improving physical and psychological symptoms of menopause while improving muscle health and reducing blood pressure in middle-aged women. That's saying a lot. So here's the University of Molise, that's in Italy, and the University of Naples. It's in the journal Maturitas. It's a great journal. It's a European journal. And it's 60 menopausal women. They were between the age of 50 to 55. They gave them fermented soy. Soy has equol in it, EQUOL. And they gave them resveratrol every day for 12 weeks, because resveratrol is also vasoactive. So let's explain that. Grapeseed is known for being great for blood vessel health. It makes blood vessel tone of an older person equal to that of a much younger person. Resveratrol is similar. It has a very good vasoactive activity. In fact, they use resveratrol frequently in studies of the aging brain. It really restores circulation to the aging brain, and it helps protect and even improve memory and brain function. Great supplement. I take it every day. I am an older guy. So 60 menopausal women between the age of 50 to 55, they gave them fermented soy because it is equol, and resveratrol every day for 12 weeks. Resveratrol with the soy really improved the number of hot flashes. It improved vaginal dryness. It improved sexual health. It reduced insomnia. It improved their mood. It clicked their mood up a couple of levels. A significant impact. I mean, it was really a game changer. So in Minerva Gynecology, Maggiore Hospital, and the gynecology clinics in Aosta, Italy. Aosta is a town in Italy that's up in the mountains, all the way in northwestern Italy. It's northwest of Milan and Turin. It's a crossover, double-blind, randomized human clinical trial. This is the best sort of study to me. A crossover study means some of the women got the resveratrol and some of the women got the placebo. And then they stopped, so, for a designated period of time. And then they stopped, and typically for a month, so the effects of the resveratrol dwindle, and then they switch them over. Those previously on placebo are now on resveratrol, and those previously on resveratrol are now on placebo. So this is a crossover double-blinded study. 50 women with hot flashes, so it's really 100 women because it's a crossover study. They used a scale of 0 to 10 for the intensity of the hot flashes and all the symptoms. Resveratrol really reduced the number of hot flashes by 57%. But not only that, the intensity of the hot flashes was strongly reduced. And this was in 80% of women. And the length of the hot flashes was shortened. So this really was affecting their quality of life. They're sleeping better, they're less stressed out, they're not having the sweating and the hot flashes. It means a lot, because if you're sleeping better at night, you have more energy in the daytime. So here's the last study. This is the research group for sexology in Catania, Italy, and some gynecological clinics in the hospital over in Catania, Italy. It's in the Journal of Endocrinological Investigation. It's a 6-month-long study. And they combined 4 natural things. They tested resveratrol and quercetin. They're cousins, really. Resveratrol, quercetin, grapeseed, they're all related. They tested resveratrol and quercetin, Equal, which you'd get in fermented soy, and passion flower. Passion flower is very soothing. They gave 60 postmenopausal women a combination of these for their hot flashes. All menopausal symptoms significantly improved. So quality of life was restored. And once again, that's a hard thing to do. You have to reduce the symptoms enough that these women are enjoying their life again. So it was clicking their mood up. It was reducing their feeling of stress and anxiety. It was improving their sleep, so their insomnia was better. They had more energy in the daytime. Their hot flashes improved. Their blood pressure was normalizing. Sexual function also improved significantly by the end of the study. Now, other studies show that flaxseed is helpful. Vegetables can be helpful. Adding certain vegetables to your diet. So even just adding more salad greens and melon and garlic and vegetables to your diet can be helpful with hot flashes. So thank you for tuning into the Invite Health podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Please subscribe and please leave us a review. You can follow us on Twitter, Instagram, and Facebook at Invite Health. Hope to see you next time on another episode of the Invite Health podcast. Thank you so much for listening.